Good afternoon and welcome. Today marks the start of the next chapter in this country's fight against COVID-19. A few hours ago, the Prime Minister announced, thanks to the progress that we've all made, we will be lifting the Plan B measures and returning to our original Plan A. This is a moment that we can all be proud of. The culmination of a brilliant national mission that helped us to withstand the Omicron wave and restore more freedom to this country. It's a reminder of what this country can accomplish when we all work together. We'll shortly be hearing from the Chief Medical Advisor to the UK Health Security Agency, Dr. Susan Hopkins. But before we do, I wanted to talk about how we got to this important milestone and what this means for our fight against this virus. Let's start with how we got here. Back in July, we made the decision to take step 4 of our roadmap so that we could roll back the restrictions and move closer to normal life. This wasn't an easy decision, but taking this step when we did, backed by the warmer weather and the school holidays, it helped us to enjoy the greatest possible freedoms for a number of months. And as I said when I announced that change, this showed us how we can learn to live with COVID. But I also warned that a more harmful new variant would have the potential to set us back. 4 months later, our scientists, learning from their colleagues in South Africa, were amongst the first in the world to help identify a new variant, Omicron, a variant that was capable of spreading faster than any COVID variant that had come before it. Spurred by this new transmissible variant, case numbers rose to record levels, and incredibly, over a third of the UK's total number of confirmed COVID-19 cases happened over the last 8 weeks. There was a lot we didn't know about Omicron, but we did know that we were in a stronger position than the previous winter, thanks to that decision to open up in the summer and to the solid defences that we've built up over time. So we decided not to return to the lockdown measures as many countries in Europe have, because I've always been extremely conscious of the impact that blanket restrictions can have, for instance on jobs, on education, on mental health. Instead, we pursued a different path, one that allowed us to take a balanced and proportionate approach. We put in place the Plan B contingency measures that were set out in the autumn and winter plan. These measures left us with far fewer restrictions than most in Europe, and they bought us valuable time that we could use to assess the Omicron variant and reinforce this country's pharmaceutical defences. Since we announced Plan B, 15 million people have stepped forward to get their boosters. We've smashed records again and again, including a record 1.06 million UK vaccinations in a single day. We've also massively expanded our capacity for testing, and we expect to have some 400 million lateral flow tests available this month alone. That's quadruple our pre-Omicron plans. On top of this, we've secured even more antivirals and treatments and deployed them directly to those people with the highest risk. Thanks to this huge collective effort, we're more boosted than any large country in Europe. We've created the largest testing program of any country in Europe, and we've procured more antivirals than any country in Europe. That's why we are the most open country in Europe, and today we've announced plans to go even further. Our plan was to use the time that Plan B gave us to give ourselves extra power in our fight against Omicron. This plan has worked, and the data shows that Omicron is in retreat. Today's ONS data shows a fall in infections, including in older age groups. Hospitalizations have also fallen over the past week, and the number of patients, COVID patients, in intensive care beds is now at the same level as it was back in July. I've always said that we would open up the country as soon as the data supports it. And earlier today, that's why we announced 3 important changes as part of our return to Plan A. First, starting immediately, the government is ending the guidance on working from home. And I know that many people have already started talking to their employers about making arrangements to return safely to work. Second, from the start of next Thursday, mandatory certification based on vaccines and tests will end. But of course, organisations can still choose to use the NHS COVID Pass voluntarily. Third, also starting next Thursday, we'll no longer legally mandate the wearing of face masks. But we must suggest that they are worn in enclosed and crowded places, especially where you come into contact with people that you don't normally meet. These changes will take effect sooner, even sooner, in classrooms, where we will no longer require face coverings from tomorrow, and the Department of Education will shortly remove the guidance on their use in communal areas. As well as these changes, we're also exploring where else we can ease restrictions. We're looking to replace legal requirements on self-isolation with guidance and advice, and in the coming days, I'll be setting out our plans to further ease restrictions on visits to care homes. The steps that we've announced today represent a major milestone. But it's not the end of the road. And we shouldn't see this as the finish line, because we cannot eradicate this virus and its future variants. Instead, we must learn to live with COVID in the same way that we've learned to live with flu, and we'll be setting out our long-term plan for living with COVID-19 this spring. We must stay vigilant and be mindful that there could be bumps in the road ahead. Although we've worked hard to make sure that the NHS will be ready and resilient, building Nightingale surge hubs and signing new deals with the independent sector, it is still facing significant pressure this winter. Even before the Omicron wave, we had a COVID backlog of elective care. And now, unfortunately, that COVID backlog will be larger still. So we must proceed with caution. A pandemic is a marathon, not a sprint. Even on this day of progress, I'd urge everyone to think about what they can do to help keep the virus at bay. Whether it's washing your hands, letting in fresh air, or getting tested and self-isolating if you're positive. But the best step that we can all take is to get vaccinated. It was the jabs that have got us this far, and the jabs can keep us here too. I'm so grateful to all the staff, the volunteers, the military, everyone that worked on the rollout program. We asked you to come forward, and you did, in your millions, and it's because of you that we've been able to take these steps today. But for as long as there are people who haven't been protected, we know that our defences aren't as strong as they should be, and the NHS will be under more pressure than it should be. So please, if you haven't had your first, second, or third jab, it's time to come forward. help us keep this success story going and protect the incredible progress that we have all made. Now I'd like to hand over to Susan, who will talk us through some of the latest data.
Thank you. First slide, please. So this slide highlights the number of cases that we've seen testing positive in the UK. And two important points. One is that you can see that in December, January, we had a threefold higher number of cases detected than we did in a similar period last year in the middle of the Alpha wave. The most recent 7-day average is 93,210 cases per day, and that has come down quite substantially from a peak on the 29th of December at almost 225,000 cases. Next slide, please. And this is also reflected in our hospitalisation data. Here you can see that we have reached case numbers of less than 20,000 in cases in hospital across the UK. And again, that is less than half the peak that we saw last December, January 2020-2021. It's also important to note that there are only 703 patients in mechanical ventilator beds, and that's at a level that is as low as last July, when we also opened up in this country. It's also much, much lower than we saw in the wave in last January. And this is reflecting our high levels of vaccination in the population and also the reduced severity that we have seen with Omicron. Next slide, please. And here you show the amazing progress that we have made with 52 million people who having received their first dose, more than 48 million people on their second dose, and 36.6 having received their booster or third dose. That's 2/3 of the eligible population in this country. And we have more to do. We really need those other individuals who have not had their first, second or third dose to come forward as soon as possible to have the greatest levels of protection. Next slide, please. Here, this shows you the benefits of protection with vaccination. What you can see on the slide, the first graph, is the levels of protection in individuals who are admitted to the intensive care unit. And if you focus on the red colouring, what you can see in that is more than half the people being admitted to ICU over the last 7 or 8 months are unvaccinated. And if you also see the smaller proportions that have had 2 doses and a booster in comparison to the general population. And you can see in the general population, only 10% of individuals are unvaccinated, but those individuals are disproportionately being admitted to ICU. The greatest thing that you can do to protect yourself against ICU admission and hospital admission too is get vaccinated. Next slide, please. And here it shows why we're in such a good position in this country right now, why we've seen reductions in our hospitalisation compared to where we could have expected a month ago, where we see reductions in our case numbers and falling case numbers in the country. This relates to our booster campaign. And we have now got, compared to comparable countries across Europe and North America, the highest rate of boosters in our population overall. We can see that other countries are rapidly trying to increase their booster campaign. And we also know that this is affecting their hospitalisation rates and cases in their population. So the strongest defence we have against the Omicron wave that we are now experiencing and any future waves of variants that we might experience is vaccination. So I urge everyone to take up their offer as soon as possible. Thank you.
Thank you very much, Susan. Now we're going to turn to questions, and the first 2 questions are for members of the public. And I believe the first one is Christina from Berkshire.
Given the increasing number of hospitalizations of young children with COVID-19, are there plans to vaccinate children under 12?
Thank you, Christina, for your question. That we, at this point, first of all, our vaccination program is focused on the over 12s at the moment, and as you've heard, we have had great success. But you're right to raise under 12s, and we take advice from our expert advisors, the JCVI, and we have asked them to look at this. And at this point, what they have advised us is that we should vaccinate under 12s that are at risk, and that is exactly what we plan to do, and we plan to start that this month. but they are keeping that under review to see if we should expand that more broadly to everyone in that cohort. Thank you, Christina. Next, I believe it's Michelle from Lincolnshire.
Please can you explain why the self-isolation period has changed to 5 days with negative lateral flow tests, when right from the beginning of the pandemic it has been advised that if you have had COVID, then you shouldn't do a lateral flow or PCR test for 90 days as you could have false results. This question needs to be answered as people are losing faith in the system.
Susan, would you like to take that on?
Yeah, so what we know is that you can remain PCR positive for quite some time, which is why we don't advise repeated PCR tests unless you've got new symptoms. However, lateral flow and the evidence for lateral flow has come hard and fast over the last 6 to 9 months. And what we recognise now is that once individuals have finished their infectious episode, those lateral flow tests become negative and remain negative for the vast majority of people. What we have now advised is that, and looked at very carefully, is that the individuals who have 2 negative lateral flows can be released from isolation early. The earliest that can be is after their 5 and 6, so release on day 6. And that allows people to get back into the workplace and to get back out into school as well. So it's really an emerging evidence and changing the evidence base rather than any new advice in that way. Thank you.
Thank you, Susan. Next, I will turn to the journalists, and the first I have on my list is Hugh Pym from BBC News.
Thank you, Secretary of State. First of all, one for you. How can the Prime Minister continue to lead the country when one of his most senior MPs in the Commons has called on him to resign? And one for Dr. Hopkins. Cases have risen rapidly, fueled by Omicron. Do you expect them to continue falling quite quickly?
So thank you, Hugh. I was with the Prime Minister today in Parliament when he set out our response to COVID, and there was a huge amount of support for what he set out, and anyone could, I think, see that whether you're in Parliament or watching. And obviously, what we've seen in the last few weeks and what we've been seeing, whether it's in our newspapers, on the BBC or elsewhere, it's caused a lot of pain and anger. And I, of course, like anyone else, I absolutely understand that. And the Prime Minister he's come to Parliament, he's apologised, and he has asked for the time and space for the investigation that's taking place to be completed so the facts can be established, and then he will come back to Parliament and answer any questions and be happily scrutinised on those facts once they're established.
Thank you. On the cases falling, so we've seen cases fall now for the last 2 weeks, and that is good news, and actually they're starting to fall all across the country in all regions. There is, of course, some age differences. Some age groups are seeing plateaus or some still slight rises. Therefore, while we believe that overall we will continue to see declines in cases, that may plateau at some points as the infection is in various different populations. It's very hard to see beyond 2 to 3 weeks, and clearly the biggest change that's going to happen is people's behaviour. And people's behaviour and how they react to the removal of Plan B will determine how fast infection can spread in the population. The biggest response that we all have as individuals is to take our personal behaviour seriously, and that really is driving towards vaccination uptake, as well as remembering to wear face coverings when you're in enclosed spaces with people that you don't know.
Thank you. Next, I have Tom from Sky, please.
Thank you, Secretary of State. What is the public health justification for ending the requirement to self-isolate if infected? And if the government does bring that forward, is it prepared to do so against the guidance of the WHO during a global pandemic? And given the suggestion that today's announcements have only been made given the political difficulty the Prime Minister finds himself in, do you as Health Secretary offer him your unqualified support, or are you, like Rishi Sunak, going to reserve judgment ahead of the Gray report? And can you hand on heart say that you've never bent the rules? Okay,
well, let me start on that. I mean, first you asked about the self-isolation rules, ending the self-isolation rules if you're positive. Of course, that is still a requirement. That it is something that, as I've said a moment ago, the Prime Minister has referred to today, we will review. So there's no decision on that at this point, but it is clear that despite the changes that we're announcing today, there is still a very high rate of prevalence, I think around 1 in 20, according to the latest ONS data. And it is important currently to keep those rules in place. We will, of course, review them. I don't want to presume the outcome of that review, but it is reasonable to think, just as we're living with flu, for example, we don't require people to legally self-isolate, but to remain cautious, to be sensible if they're infected. We will, I think, eventually have to find a way to live with COVID in a similar fashion. On your question about the Prime Minister, I fully support the Prime Minister. And as I said a moment ago, it's important to me and to the country that he's come to the House, he's apologised, and I think it's right that we're waiting for the outcome of the report. And when that is complete, this investigation establishes the facts, then the Prime Minister will come back and answer further questions. And I think you asked me about me and rules, whether I have observed the rules, if I heard you correctly. And I can say, with full confidence, I've absolutely observed the COVID-19 rules at all times. And I would say, like millions of people across the country, it hasn't been easy. Like millions, my mum lives alone. I couldn't go and see her. I couldn't go to a close friend's funeral. It wasn't easy, but it was the right thing to do, as millions have done up and down the country when they were asked to. And it's important also that if we look at today's announcement, that because millions and millions have observed the rules, they've done the right thing, that we can take the measures that we're taking today and remove these restrictions on our freedoms, which should always be a last resort. So I'm proud of the British people and what they've allowed us to achieve in our fight against this horrid virus. Susan, did you want to say anything on the self-isolation rules as well?
Well, I mean, I would just add that for the vast majority of conditions, either self-isolation as cases or self-isolation as contacts of cases isn't a legal requirement, but we give solid public health advice and people follow that. Even now, people are as cases within the rules, they are able to take testing to leave early, and as contacts, if you're vaccinated, you're able to leave every day, having done a daily lateral flow test. So I think it is just one element of the restrictions. I think if we removed all elements on cases and contacts right now at this moment in the pandemic, that would be different. But a legal requirement is only one component of it.
Thank you, Tom.
I mean, should remain in place for the time being, though, bringing it forward. The Prime Minister hinted at bringing it forward earlier in March, yet we still have cases, the highest levels of infections we've ever seen from COVID in the UK.
Well, Tom, just to say that review is something that we will do, but at this point in time, those requirements, the need to self-isolate if you're positive, remain very important. May I next turn to Emily from ITV, please?
Thank you, Secretary of State. I wondered whether you are personally frustrated that you are constantly having to defend the Prime Minister's actions while at the same time having to deliver very important public health advice. And also, if I may, just to follow on from Tom's question, is what you're saying today that by the end of March we will effectively be living with no restrictions in place whatsoever?
Thank you, Emily. And again, when it comes to what has happened in number 10, the photos and videos and things that we've all seen, and we've all, understandably, I think all of us have been pained by that, angered by that. It is right for the Prime Minister to respond, and he has responded in Parliament, and he will come back to Parliament once the investigation is complete. And I think that is the right approach. In terms of what happens at the end of March, I think, first of all, we can reflect on the last 8 weeks. That's what it's been. I know it probably feels like longer with Omicron. It's been 8 weeks. As I said, that accounts for a third of all the COVID-19 infections we've seen thus far throughout this pandemic. And if we look back at that, I do think we've got all the big decisions right. We didn't get, throughout this pandemic, we haven't got every single decision right, all the small ones, but we got the big decisions right. And that's ultimately what matters. And that's why we're able to take these steps today and be the freest country in Europe. Now, there still are some requirements, restrictions in place, such as the need to self-isolate if you're positive. There's some travel requirements still on LFD testing, and it is right that we review those. And I will come back in the spring and set out how we will live with COVID. But the way we are going to do this is that we are going to have to find a way to remove almost all of these restrictions and get life completely back to normal, but with one or two really big things that I think that will be there for a while. That is probably the need to vaccinate. I can't tell you how often that will be, but I think vaccinations will remain hugely important, just as we have to have annual vaccinations, certainly for older people against flu. And I think antivirals and treatments will continue to play a big role, especially for those that might be more exposed. And I think testing, it's great where we are today with testing. I think it will improve over time. And these pharmaceutical defenses of the vaccines, antivirals, monoclonal antibodies, and testing, I think they will be the cornerstone of our future defenses. Thank you, Emily. I'll next move to David, please, from PA.
Health Secretary, the latest recorded daily deaths figure is 359. You're now lifting restrictions. Is this the kind of daily death toll you think the country has to be comfortable with as part of the shift to living with COVID? And after the events of the past few days, do you think the Prime Minister is living on borrowed time? And will you be throwing your hat into the ring in the leadership contest again? And to Dr. Hopkins, is the UK HSA completely comfortable with the measures that were announced today? And has any assessment been made of what they will do to cases, removing the legal requirements on face masks and the end of the work from home guidance?
Good. Thank you for your question. Look, first on the daily death toll, it is throughout this pandemic some over 150,000 deaths that we've seen. People across the country have lost their friends, their loved ones, and of course, no one wants to see anything like that, and it's happened across the world. Thankfully, we're in a place today, because of the vaccines primarily, that the death rate has fallen dramatically. And as Susan had said earlier and shown with the data, with Omicron in particular, the number of people in intensive care is even lower now than it was before Omicron came along. And that's important. But again, we can't stress enough how important it is to get vaccinated, because that's the way to keep deaths low. You mentioned the number of people dying, and you mentioned the latest number. The numbers do vary day by day. There are some reporting differences depending on which day of the week that is picked. But if you look at the average daily death rate, the 7-day average, I think it's around 200 in England, which is a lot lower than it's been before, and we want it to get lower. And there's something else I think is important to point out about the death rate, which maybe Susan might expand on when I'd come to her. It is also with Omicron, we know that if we look at infections of people with COVID in hospital, we estimate around 40% of the people with COVID in hospital are there not because they've got COVID, they happen to have COVID. So it's what you might call an incidental infection. So they're not there being treated for COVID. And that's almost double the percentage that we saw with Delta. And that's important because the deaths that are being reported of people that were COVID positive within 28 days of passing away that many of those people would not have necessarily died of COVID. And what we're seeing in hospitals, that proportion of roughly 40% not being there because of COVID, is an indicator of that. What Susan might expand on is that the ONS has very detailed data on that, which I think they'll come out with shortly, where they look at the actual cause of death on death certificates. And I think that will be important data when it comes. Your second question, you asked about leadership. Well, look, we have a leader. We have a prime minister. The prime minister is busy delivering for this country. He's delivered on Brexit. He's delivered on jobs. He's delivering on fighting this pandemic. And I've got a job, and that's a very important job, and that's health and social care. My job is to make sure that health and social care is the very best it can be in this great country. Susan.
Great. So I'll take it in two parts. So first of all, on the deaths within 28 days, we regard this as a leading indicator and something we monitor very carefully. But as the Secretary of State has said, it doesn't take into account people who've died with COVID, who've had a diagnosis. And given the very large number of cases that we've diagnosed in the last number of weeks, we will sadly see some people, particularly the very elderly, who die within 28 days of a case of COVID. So we look very carefully at the ONS data, and ONS data release their data weekly. However, in the last 2 weeks, it's always lagged because the death registrations need to come through. And we will continue to keep a monitoring on the number of deaths that we're seeing within 28 days and the number of deaths that ONS are reporting that are on the death certificate, so therefore related to the death in some way. And if we see those diverge, we will discuss it further and highlight the reasons for that. On the second part, which is the components of face coverings and working from home. So I think what we've seen is that case numbers have declined. It's people's behaviour that are going to make the difference over the next 4 weeks on whether those case numbers continue to decline, stay the same or rise. Clearly, when you're working from home, you have less social contact, but we're already seeing some people start to go back into the office and mix and socialise more. They need to do that carefully and within the guidelines, taking care, particularly when they're on public transport in indoor spaces and crowded places, to wear face coverings, to test regularly if they're going back out and meeting people, particularly those who are more vulnerable. And finally, to ensure that they've taken up that vaccination offer. Because at the end of the day, the more people who are vaccinated, the less likely we will see large transmission, especially in those individuals who've had a booster dose.
Thank you, Susan. Next, Jane, please, from the Eye.
Thank you. To the Health Secretary, can you rule out a return of Plan B if another variant of concern emerges? And also, the Prime Minister said today that the government has got the big things on COVID right, and I think you've echoed that, including not introducing tougher measures in England over Christmas in response to Omicron. But the Prime Minister just got lucky, didn't he? Boris Johnson wanted to introduce tougher measures before Christmas, but he was blocked by the Cabinet and the Tory party before Christmas. How can he portray this as strong leadership when he was left with no choice? And if I could also ask Dr. Hopkins, what is the scientific evidence and your assessment for scrapping self-isolation in March or even earlier, as the Prime Minister has suggested today? Thank you.
Thank you for the question. First of all, in terms of looking ahead, as I said a moment ago, this pandemic is still with us. It's not the end of the road. There will be bumps on the road ahead. None of us know what these bumps are going to be. There will be future variants. There are many variants between Delta and Omicron, but many of them, they weren't that dangerous and that much of concern. But then suddenly Omicron comes along, and then we all know what happened. So we have to remain vigilant for against future variants, and also learn from what we've done. And what we have learned, and I think especially over the last couple of months, is that our pharmaceutical defenses really do work. You know, the vaccines, especially the boosters, the testing, the mass testing, and the focus on antivirals and other treatments, and also how the British people respond. Because when Omicron came about and we were very open about it and the risks, the British people responded fantastically in such a responsible way, taking tests if they were meeting, perhaps elderly people or going to a high-risk place, getting vaccinated in their millions, the most boosted country in Europe. So I think these are the kind of measures as we look ahead. And then to your second point, that I think you said something like, did the Prime Minister just sort of get lucky? Of course not. The Prime Minister has shown leadership throughout. But when we think about the emergence of Omicron and what happened, of course, as ministers, we receive lots of advice, not just on the public health risk, which is hugely important advice. We get advice on what might be the impact of certain measures on the economy, on education, on other health issues, mental health, cancer outcomes. These are all vitally important. And what the Prime Minister has to do, and only he can do as the head of the government, is to balance all those up and come to a judgment. And that's exactly what the Prime Minister did. And the central decision that he made, which was to absolutely focus on boosters, has been vindicated. And when you look back at those charts that Susan shared earlier, if you look at the booster rate in the UK, not just versus Europe, but even countries like Israel that started before us, when you look at that, that is the main reason we are where we are today, because the Prime Minister made those decisions, the country responded in their millions, and it's left us where we are today, opening up the country, of course remaining cautious and vigilant, but we can take the measures that we've taken today. Susan.
So I think calling it scrapping self-isolation is a bit simple. What we have done over time is look at the evidence. We now reduce the isolation period for people who are cases from what was 10 days down to potentially just 5 days if you have 2 negative lateral flow tests. So that's almost half for many people. In addition, for those people who are contacts, if you're vaccinated, you can do daily LFDs and not need to self-isolate already. And so that is the vast majority of the country, as the vast majority of the adult population have had 2 doses and therefore meet that. For other individuals, we still ask them to self-isolate, and we'll continue to look at that and look at alternatives and review the scientific evidence. And we will continue to monitor the impact of this virus in the population. And I do come back to the fact that for other diseases, we recommend to people how long they isolate for when they've got symptoms, and we recommend to contacts how long they isolate for if they're a close contact. But we also use other things, such as treatments and prophylaxis, to prevent disease. And as we move through this pandemic, we will develop new tools, like we've developed lateral flow, to allow us to change the approach and to use science to inform government policy.
Thank you, Susan. And then finally to Yasmin at the Financial Times.
Thank you. I just have a couple of questions for the Health Secretary. Given the ongoing anger over parties in Downing Street and Whitehall, what's your response to those watching from home who would argue that the government's really lost all credibility when it comes to leading the nation through these final stages of the pandemic? And secondly, just to follow up on David's question about impact assessments, in Prime Minister's questions today, Labour called on the government to publish the scientific evidence supporting the PM's decision to move to Plan A. Do you plan on doing that? And will you be publishing some form of impact assessment on the lifting of restrictions, say, for example, on the health service? And finally, are you able to provide any update as to when the government will be changing the definition of fully vaccinated to having 2 jabs and 1 booster?
Okay, thank you very much, Yasmin. You're absolutely right to point to the public anger, how pained people have been through what they've seen and learned, whether through media publications, through TV, around parties and all of that, and everyone's been angered by it. I've been angered by it. I'm pained by it. You are, I'm sure, and that is perfectly understandable. And it is right that the Prime Minister has come to Parliament. He's accepted already that there's been mistakes, but he has asked for a proper, thorough investigation to be done to establish the facts, and then he will respond to that. He will properly respond to that, to Parliament and to the British people, as he should and as he said he would. And that is going to be an important moment. And the British people, once they've seen the outcome of the investigation, they've heard the Prime Minister's response, then they can make an ultimate judgment for themselves, as they should. It's their country. They vote in a government and decide what should happen. It is their right that they get the full facts and decide for themselves. But I absolutely understand the anger and the pain. And in terms of the second part of your question, the evidence around the decisions we've made, that throughout the pandemic, we've been sharing evidence through Parliament and through on the website, for example, of the UKHSA and in other ways. And we will continue to do that, be open and transparent. And there'll be many impact assessments that we've published with respect to the pandemic. And we always keep that under review, and we're as transparent as we can be. That's really very important. And having sessions like this, where it's members of the public or people like yourself, Yasmin, can ask us questions. Anything you want is part of that transparency. And then in answer to your final part of your question, we are looking at the definition of fully vaccinated. It is something that if we just look at what we've learned in the last few weeks, we know that 2 vaccines are not enough against Omicron. They're nowhere near enough. They just don't work in terms of protecting you, certainly from hospitalization. But we know that 3 vaccines that they can give you, I think, is it, Susan, 88% protection. 88% protection against hospitalization. And so they work. And that's why we are where we are today. That's why we've made this progress. And it's right that we keep reviewing and updating the definition of fully vaccination, but we've got to think about how that would work in practical terms. So we are looking at that. And if I may, since it's the final question, it allows me just to finally say, please, to anyone listening, if you're eligible and you're not boosted yet, please do come forward and help yourself, your loved ones, and most of all, help our great country. Thank you. Thank you all very much.